Hi, I'm Kristen Wellheit with SustainableHolistic.com, and I'm here today with Dr. Cantu, Dr. Greg Cantu, and he's been helping me with an old brain injury that I had that I didn't even realize that it was affecting me as much as it was. And since I've been working with him for about the last 10 weeks, I've seen significant change. And I just have to say it's really nice to be able to have more control over my emotions and PMS, and also have more mental alertness that is allowing me to stay focused and to accomplish my goals.
Okay, so here we're making the connection between the neurofeedback that I explained earlier and actually displaying brain waves. This is actually validating that the energy is overactive or underactive on the brain. So we're going to set up Kristen here, and we're going to start the computer, and you'll see the process. It's very simple, it's non-invasive, nothing's going into the body. We're measuring brainwave activity in front of the screen so that the brain can learn to create some changes and balance itself and heal itself. So we're going to go ahead and get started. And Kristen knows the routine. She's working with yellow down. We want to keep the clicks going. So we have a display of good energy, unhealthy energy, and overall energy at the top. So this is the way that we learn to work with our own brain waves, and the brain has an opportunity to make some changes. So the dings you hear are reinforcement. So when you maintain the good brain energy and are able to inhibit or decrease the bad brain energy, you get a ding or a reinforcement. So that translates into points, a reward count, at the top of the screen. So it's a very natural process, it's very easy. The patterns that I can see are various. We can see irregularities from old head traumas that show up as spikes, low energy, overactive energy. We can see stress response when people are stuck in stress response. There's a variety of patterns that correlate to what's actually happening in the patient on a day-to-day basis. Not enough energy, too much energy, stress, overactive patterns from stress and anxiety. These patterns are driving symptoms. So when we find imbalance in the brain, we're actually correlating that to symptoms in the body. And the reason we know that these were causing symptoms is because when the brain balances and we see the pattern normalizes, the symptoms diminish or they go away completely. They completely resolve sometimes. It's not uncommon for that to happen. So we have a simple process that's helping the brain to balance. On my end, it's very technical, but for the patient to go through this, it's very simple. We can also see patterns like blood sugar dysregulation and even low blood sugar, which causes a very low energy in the brain, and it makes it hard for the brain to function. So this would affect kids in school because when their blood sugar drops, their brain isn't going to work the way it was when they had enough fuel in their brain when blood sugar was normal. And also with sleep deprivation, it can cause kids and adults to be tired during the day. And so when we help with sleep patterns, we can put in there very specific patterns to retrain and bring up the calming brain waves if they're deficient, or the very unhealthy overactive brain waves, and bring those down. That helps with sleep, anxiety, and it's just a balancing process. You know, I could explain a lot longer video in a lot of detail. Usually reserve that for practitioners and doctors that I'm teaching the combination of tools that I'm using.
So, Dr. Greg Cantu, thank you so much for showing us today more about your neurofeedback and how it works.
My pleasure. Nice to be here.